Well, hello and welcome to Talk Time. Now, this week, we're going to be going into the medical field. We're going to be going into a disease, which sometimes is forgotten, sometimes it resurfaces, and so on. And we are told that there is a resurgence which is being dealt with. I'm talking about tuberculosis. That's what we're looking at this week. Welcome to Talk Time.
It all begins as a cloud high above Ghana, where tropical rain falls in the rainforest. The rain passes through fractures in ancient rocks and begins its journey deep beneath the earth. Interacting with these rocks, it gathers essential natural nutrients in unique proportions. The rocks produce the essential natural mineral compositions required for healthy growth. The water finally accumulates in a natural aquifer where it is protected from pollution. Retaining its original purity and natural minerals, it is then extracted by our experts, where the remaining particles are removed. The water is then sterilized to keep it fresh and safe before it is bottled and made ready to drink. Not all bottled water is natural mineral water, so when in doubt, look for Voltic natural mineral water. Voltic, naturally.
Hello, welcome back to Talk Time. And as I indicated, we are talking about tuberculosis. And we are talking about tuberculosis with somebody who should know his stuff. We're talking to Dr. David Kwesi Affreh, who is the Executive Consulting Secretary of the Stop Tuberculosis Partnership. And let me start, first of all, welcome to the studio.
Thank you, Uncle Kwesi.
Yes, sir.
It's a pleasure having you today.
Now, first of all, when we talk about tuberculosis, what are we talking about? What is tuberculosis?
Thank you so much, Uncle Kwesi. Tuberculosis is a disease caused by germ. To liken it to our modern day Ghanaian is to mention that it's just like how COVID came. COVID and tuberculosis are like twins. It's caused by a germ. So it's a bacilli that is entered your system and then causes damages, and then it becomes a disease. And so tuberculosis is one of the oldest diseases. In the 1930s, you have it coming just like COVID came. It has been in the system for a very long time. It has been declared as an emergency before, just as COVID went through the same trajectory, and we found ways and means to curtail it. But TB has been in existence for so long, and it attacks the lung. It attacks mostly the lung. And if you are TB positive, if the TB disease comes out into your system, you cough persistently, you have pains in your ribs, you have body pains, you sweat a lot in the night, you lose appetite, you suffer fever, and these are critical symptoms, just as it used to be for COVID. And in fact, it knows no boundaries. It knows no age. You have children under 5 even suffering from TB in Ghana. You have people within the space of 25 to 35 who are suffering heavily. But that's what the data shows. Those who are aged from 55 and above, they are suffering from TB. And so all kinds of people, all kinds of generations, whether male or female, whether you are pregnant or whether you are in a class of the elite, or you are in in fact, prison somewhere, or you are working in parliament or in one office somewhere, or we in the studio, we are all affected, and so TB is in the system, and we need to tackle it at high levels.
Where did it come from? At least in the case of COVID, there is some knowledge about where it came from. Where did tuberculosis come from?
Yeah, it's the same thing. It's the same thing. It's just as COVID emerged from the stories of, I don't want to go pointing figures at where it generated from, but we heard a lot of story about the countries it started from. It's the same way the disease came, and then researchers went into it, and they discovered that it was a bacilli. It was a germ that they called the bacilli, the tuberculosis. And so tuberculosis is just the name given to it, just like COVID-19 came, is from the SARS group of germs. But
is it indigenous to Africa?
See, TB is a global disease also, but
I'm talking in terms of its origin.
No.
So where did it come from?
We have moved the argument from the sources of this.
No, it's not an argument, just a statement of fact.
Yes, I understand. But as much as possible, we advocate. You just like the story of HIV also. We try not to go into the history of some of these things, just to make sure that we focus on how we can curtail the situation. And so we are not interested in trying to let people's mind go into where it is coming from. But the fact is that it is with us and it is killing. And for Ghana, if you are interested in some of the statistics, I can give you.
We'll come to that
Okay.
later. But you said that it is a germ.
Yeah.
How did this germ come into being? Through mutation? What happened to produce this germ?
Okay, so just as COVID came, it's the same way. And so the people that first got this, how did they transmit it? Now, it first enters your system. The difference between TB and COVID is that TB takes a longer time for it to incubate in your system, and then the disease comes up that can be detectable in the laboratory. And so when a person takes in the germ, in fact, the fact is that the weather in Africa, the weather in Ghana for that matter, it's the humidity level makes it more conducive also for TB to prevail. And so the Afro region, which is more of savanna and so a lot of sunshine, we have more prevalence. We have more burden of the TB than the other countries that are of the cold zones. And so it's being in the air, just like the first people got it. And then once you sneeze, once you are singing, as you are talking, as you are coughing, you cough out the bacilli through the droplets of saliva that comes out of your throat. And so eventually, people in enclosed environment like where me and you are, in the cars, in the homes, and in the offices, and in the small bedroom, mostly not even having best of window and for ventilation to flow, you have people now getting infested year on. And so that is how the disease entered the system, and it has been with us. There's medication for it. There is treatment for it. In fact, it can be cured. And so the whole world recognized that there is this disease. And that is why we even have a global fund. The global fund is a global resource mechanism that is fighting tuberculosis, HIV, and malaria. And so the whole world recognizes that TB is a real issue. It has ever been declared as an emergency, and it is killing. And the statistics are quite overwhelming, especially in the Afro region. And that is why when it is World TB Day in March, we are more interested in talking more about it and hoping that we can have more collaboration with the media to have sustained communication to drive to ending TB by 2030, as that is the global agenda.
How widespread is the disease in Africa?
The story is the same in almost every country in Africa. In Ghana, because the populations differ from country to country. If you come to Ghana, we are, according to the WHO estimations, confirmed by our own national TB program, surveillance shows that if you take every 100,000 population of Ghana, you have active TB cases of between 155 to 200 human beings that are actively living with the disease within every 100,000 population. Now, we are therefore estimated to find 44,000 people living with TB, active TB in Ghana annually. As we speak, we are not able to find it. That's the fact. What we're able to find in Ghana, the highest so far happened last year. Around 20 years ago, we were around 6,000, 7,000. And then around 10 years ago, the statistics went up to around 11,000, and it moved to 14, 15. During COVID, we were able to hit around 19,000. Last year, 2024, the TV program statistics shows that we have found about 20,400 people last year. So the gap of people not being found is huge, and they are there. And if the little effort that is put into finding some of them, you are able to find a lot. And so every day, more than 100 people, 200 people are being put on treatment day on day. I mean, you can imagine if we are talking about finding 20,000 people in Ghana within the space of 365 days. And so a lot of people are found every day, and they are being put on treatment. And so it's there. It's quite prevalent. I mean, if you take the 100,000 population, and you are finding about 150 to 200 human beings that are living with the disease, that tells you that it's a serious issue. And that is the situation across the neighboring countries in Africa. Just that the population differ from place to place, because in Ghana we are finding 44 because our population is capped at 33 million human beings. If you go to Togo, which is about 7 million people, the statistics will be different. Otherwise, we have the same human beings that are traveling across Africa, and therefore the spread is the same. But of course, you will find it more burdened in one country than the other.
Now, when the germ enters the body,
Okay.
what does it do to the body?
Okay. So, once a germ enters the body, it settles down to look for places to grow. And so it enters the system and settles in your immune system, settle within the blood systems, the veins, and then begin to grow. Now, what happens is that tuberculosis is not so strong if you are healthy. So what it means is that the virus, the germ is settled in your system, and because you have a good lifestyle, you eat well, you exercise well, you have good life. And so what happens to you is that the nutritional values of your system, the exercise impact and all of that keeps you strong. But the day your lifestyle changes, for example, you become more alcoholic, and then you are less sportive, and then you begin to fall sick. Now, what it means is that you have undertaken some level of activities. Maybe malnutrition happens, alcoholism happens, smoking happens, and then your system degenerates. Once the system degenerates, the bacillia is able to come up quickly. And the moment the bacillia is able to come up, it overtakes the system. And once it overtakes the power of your system, it means that your immunity is going down fast. Your immunity is going down fast. It means that the disease is coming out higher and stronger, and to overcome your human body. And once it overcomes every other red blood cells and the active cells in the system, you are about to die. In fact, the moment you are not getting treatment, you are about to die. You cough and cough and cough and cough and cough out droplets of blood, and the pains will continue. You lose appetite. You cannot eat. It will suppress you until you go down. And most of the time, if you see the pictures of sick people of the old days, you see somebody growing lean and becoming so lean that they can't even walk. And that is how they get bedridden. And then sometimes, if they are not detected at all, they die at home. If they are detected too lately, they are still in the hospital. They are not able to recover. Some of them die. The good news about Ghana's treatment success is that out of every 100 people that we detect positive in the laboratory and put on treatment, we are having more than 90 of them having successful treatment.
Well, viewers, we're going to take a short break here. And when we come back, I like to ask some questions. When you have the symptoms, what do you do? When you have the symptoms, what do you do? And we are talking to Dr. David Kwesi Affreh. who is the Executive Consulting Secretary of a partnership which is meant to fight tuberculosis. So, short break.
It all begins as a cloud high above Ghana, where tropical rain falls in a rainforest. The rain passes through fractures in ancient rocks and begins its journey deep beneath the earth. Interacting with these rocks, it gathers essential natural nutrients in unique proportions. The rocks produce the essential natural mineral compositions required for healthy growth. The water finally accumulates in a natural aquifer where it is protected from pollution. Retaining its original purity and natural minerals, it is then extracted by our experts, where the remaining particles are removed. The water is then sterilized to keep it fresh and safe before it is bottled and made ready to drink. Not all bottled water is natural mineral water, so when in doubt, look for Voltic Natural Mineral Water. Voltic, naturally.
Yeah, welcome back to Talk Time, and we are in a conversation with Dr. David Kwesi Affreh, who works for the fight against tuberculosis. Now, Doc, you have the symptoms.
Yes.
Pain in your ribs, you feel feverish, all of that. What do you do?
Yes, once you have the symptoms, you move to the hospital. Indeed, we advise that you don't need to have all the symptoms. The moment you start coughing, and we wish that you don't even go to a drugstore to want to buy a cough mixture. First, go to the hospital.
As soon as you get a cough?
Get to any government hospital.
Any cough?
Yes, once you start coughing, go to the hospital. Just as you will wish to go to a pharmacy to go and get a cough mixture, instead of going to get a cough mixture, we advise that you go to the hospital first. Mm-hmm. So what happens at the hospital? When you go, being aware that there is also a disease called TB, which has the number one symptoms as cough, you first want to eliminate that it is not. You want to rule out tuberculosis. Mm-hmm. And so the first thing you do is to go to the hospital. Once you get to the OPD, any government hospital, at the district level, at the regional level, at the national level, you just say that you have a cough and you feel that it could be TB, you want to rule it out. Mm-hmm. They will take the specimen and then take it to the laboratory. We have what we call it. Ghana uses the first line diagnosis tool called a gene expert. The gene expert machine will be used to test the sputum. You will remove a sputum. Once you have a good quality sputum, once you can remove the sputum, it's beautiful. They will go to the laboratory and test. And if it is positive, they put you on treatment. Treatment is free. And the cost of testing you is also free. Mm-hmm. Maybe if you walk to the hospital and you don't tell them that you are coming because of, you presume that you are TB, you might go through the OPD normal payment of some fees here and there. Mm-hmm. And then you, in fact, even if you become TB positive, the policy says that you should be given, if you don't have the national health insurance card, the package will provide for you to be enrolled onto the national health insurance scheme by the authority because of your condition as a TB person. And so just make sure that you go to the hospital, go through the process, let them test you and tell you that, okay, this is not TB. Go ahead and do any other treatment you want to do so that you get the cough off.
So the most important symptom is coughing?
Is the cough. The most important is the cough. See, because you breathe in the backslide, it's settled mostly in the lung. Mm-hmm. It's in your system, but mostly, see, when it wants to come up, the biggest symptom is the cough, which it's, you know, the moment the backslide is gathering more in your system, it's settled. It will settle more in your lungs. And out of the lungs, you cough. And once you are coughing, there you go. You are likely to be start having the pains in few days later. Mm-hmm. You know, it will start with a cough. And before you realize you have fever, you are having pain, and maybe you have treated the fever 1 or 2, it's not going, it's come back, and then you start having, you start losing weight, you start having sleepless nights, and then you cough even more in the night because you can't even sleep. And so it normally will begin with the cough. And so it is better if the numbers we are mentioning, with the numbers that we are estimating, the 44,000 people that need to be found and treated every year, we have to go with a high level of sensitivity. The fact is that if you have a cough and you actually have the germ in you, and you go to take an antibiotic, you are trying to curtail the strength of the germ in you. And assuming that you take 1, 2, 3 bottles of this medication before you now want to find out whether it is TB. Because of the medications you have taken, there is possibility that the machines will not pick it easily, because you have introduced a lot of medications into the system. And so we will advise that, look, before you even introduce any drugs of any sort in trying to curtail the cough, first go to the laboratory and let them check and see whether there are traces of the TB germ in you. And so if that is the case, you go straight on to treatment and you are sorted. Then going through, in fact, people end up in the prayer camps. People end up in the herbalist shops or herbalist homes and spiritual homes, and they will be coughing. The moment you have a cough, I don't want to say try and see whether it will take you 3 days, 4 days, 5 days. Once you have a cough and you feel like, no, it's not comfortable, I want to have a medication, first go and check that it is not TB. If it is TB, you go straight to treatment without any cough mixture. Treatment is 6 months. Once you go through it successfully, you are cured and everybody around you is safe.
Now, it's curable, isn't it?
It is.
As you just said.
It is curable.
Okay. Then why do people die from it?
Yes, lack of knowledge. If you don't know that, like I'm saying, somebody is struggling, somebody has no knowledge about the fact that you have a disease called TB. Somebody doesn't know in his village that when I'm coughing for long or I'm coughing and it's not going, it is TB. And you know, in our local languages, we call TB Samawa, which is actually supposed to be inframamoa. You know, it's supposed to be the airborne cough rather than the ghosts stigma that is based on it. So you have a lot of stigma. Somebody is in the community, they get to know that the person is coughing, and it looks like the person is growing lean, and so the family begin to stigmatize. So it is tuberculosis, it is Samawa, and then people will stigmatize you, people will reject you, you become isolated, and you cannot have the care you need to have, you cannot have the support you need to have, you end up dying. People don't know, people have no information. Televisions, probably we are not doing enough. Civil society is doing what they can do, but they are not covering the entire country. Government is having availability of some good coverage of about more than half the space of Ghana, so that people who actually are suffering from disease can have treatment or to be diagnosed and be treated. But you have the situation where some people don't like going to the hospital. Now, maybe this reminds me of a research that was conducted. In Ghana, it is detected that 52% of the average Ghanaian will move towards a non-government facility for treatment. And so the first point of call for a normal average Ghanaian like me and you is to go to the drugstore first, or go to a pastor or a spiritual head, and because we have the perception that most of the sicknesses we have could be spiritually induced. And so most people are also not going through the government facilities where this can be detected at the OPD and say, okay, if you are coughing, then let's do this. they need to screen you, and the screening is done at the hospital. If you don't end up at the hospital and you end up at a pharmacy, you end up at a prayer ground or a herbalist or some voodoo man's house where you are going through a treatment different from the cure the drugs that we have for the cure of TB. You end up dying, you end up spreading it more. And so lack of knowledge is making our people also suffer. And so we need to intensify education. We need to make sure that there is the diagnostics space is covering the entire country. There are some districts that are not having the machine that they use to test it. So, for example, if there is no facility, that machine is not in your district and it is in a neighboring district, when they collect the specimen of those who are presumed TB from those facilities, they have to carry that with a motorbike or whatever forms of transportation to where it can. And what it means is that the timing to diagnose is even delayed. So you might collect somebody's specimen and it might take 1 week before the results come out. And assuming that person is active TB, by the time you even get a result to the person, he's already spread it more. Some even would die even before the results are out. So we need, and for us, we advocate and we call on government commitment. We call on government investment. We call on stakeholder involvement and engagement to ensure that we are able to curtail the disease.
Now, this is the other problem. Lack of knowledge, as you say.
Yeah.
And so, what about the facilities?
Yeah,
the facilities, one for cure, and the arrangement for prevention.
Yeah, so you see, if there's any problem with any of this, I have said that in Ghana, you have about 70 X-ray machines. You have about 155 gene expert machines that are across the country. And like I said, you don't have them in every district. What it means is that, in fact, if you watch the theme for this year's World TB Day celebration, it's, yes, we can end TB, commit, invest, and deliver. We are asking that government will commit. And where is this commitment coming from? Government has an arrangement where we all agree at the United Nations level. And so in 2023, for example, the government of Ghana, then Nana Addo Dankwa Akufo-Addo, his health minister, what is the name? Honorable Kokwa Menu, was also in the United States, New York, in the United Nations General Assembly, United Nations high-level meeting on TB, where we all sign on to a commitment. These commitments are meant to make sure that we make resources available to ensure that we increase the diagnostic space to reach the hard-to-reach communities. We want to make sure that we finance the logistics that needs to be made available for the national TB program and for civil society involvement, and to make sure that we bring all stakeholders on board. In fact, there was also a commitment that we will have a high-level, we will place TB on a high-level political agenda. What it means is, look, like COVID came and we have the president himself involved in giving us updates. We have signed on to such commitment at the United Nations level. Now the government of Nana Addo is not there, but we have a new government. We are asking that new government, His Excellency John Dramani Mahama, and the ministers of health, Honorable Akando, the Parliament Select Committee on Health, the Minister of Finance, we want all of them to be aware that these commitments are there. People are dying, and we need to make sure that we read the document. We need to understand that we need to invest more in TB, and then help and support and monitor the program and its implementing partners to ensure that we are able to reach more people, get more people. In fact, one of the things we are thinking of now, in fact, when you go to, in fact, in Bali, Indonesia last year, where we had the World Health Summit, you have the new wave agenda is let's go digital. In Ghana, the machines we are using are gene expert, yes. But before you get somebody sputum, or specimen to the lab, you are using human beings to do the screening. So it is me that I'm holding a paper and I'm looking at the algorithm, and then I'm asking you a question. Are you coughing? Are you sweating? Are you this, that? Then I determine that, okay, per the answers you have given me, I presume that you could be TB. Therefore, I collect your specimen to be tested to confirm. Now, if we can use the AI, we can use artificial intelligence. If we can use other more sensitive machines to even do the screening rather than using the human intelligence, let's use the artificial intelligence. If you screen 100 people with artificial intelligence, you are likely to find about 70% of the people positive TB. But if you use the human intelligence, you are most likely to find 2 out of 10. Whereas with AI, you might find 7 out of the 10. And so if we want to speed up and catch up with the gap that we are not reaching, then we also need to invest in artificial intelligence technologies to help increase the space of education, help increase the space of diagnosis, so we can have more people being detected for TB and being put on treatment.
Okay. Now we're going to go for another short break. And when we come back, I'd like to look at this year's theme for the observance of World TB Day, and how that is relevant, to the fight against TB.
Okay.
So, short break.
It all begins as a cloud high above Ghana, where tropical rain falls in a rainforest. The rain passes through fractures in ancient rocks and begins its journey deep beneath the earth. Interacting with these rocks, it gathers essential natural nutrients in unique proportions. The rocks produce the essential natural mineral compositions required for healthy growth. The water finally accumulates in a natural aquifer where it is protected from pollution. Retaining its original purity and natural minerals, it is then extracted by our experts, where the remaining particles are removed. The water is then sterilized to keep it fresh and safe before it is bottled and made ready to drink. Not all bottled water is natural mineral water, so when in doubt, look for Voltic Natural Mineral Water. Voltic, naturally.
Welcome back to Talk Time. We are talking about tuberculosis, and we are talking with Dr. David Kwesi Affreh. Now, sir, this year's celebration of observance of World TB Day, what is the theme, what is the relevance, and how are you observing the day?
So, thank you so much for this one. This year's theme is, yes, we can end TB, commit, invest, and deliver. We have, over the years, always said it's time, let's act fast. We encourage ourselves that, yes, we can end TB, but this year we are adding commit, invest, and deliver. And that becomes the most important aspect of the team. Why do we ask that commit? Why do we say invest? The reason is that, yes, we have had a situation where governments and nations, including Ghana, have gone to the highest level at the global level, at the United Nations level, and signed the accords that, yes, when we come, we are coming to do what? We are coming to commit to fighting tuberculosis in our country. We are coming to ensure that whatever the challenges are, we drive an efficient budgeting system to ensure we do all the procurement and do all we have to do, put everything in place to make sure that the people who are dying of TB, we stop them from dying, we cure them. Now, when these are done, these signatures are put in place, when these commitment statements are made at a global level, we come to country level, and then it's kind of business as usual. We have not seen the TB on the high political agenda. We haven't seen the president of the nation being interested in talking about TB. Not even in the State of the Nation's address will you hear that this is the situation of TB in Ghana. even though we believe they know that in Ghana, daily we have more than 40 people dying. You can calculate that by the year and know the number of people who
40
die.
40 people a day.
Yes, the estimates are that we have a minimum of 40 people dying. As at 3 years ago, when the Honorable Minister made a statement on the floor of the United Nations, it was 35 a day. Now we moved to 40. Why? Because we have come to Ghana and we are not investing. When you take the global fund that invests, look, we need about $30 million annually to be able to fight TB. As we speak, the global fund is supporting the national TB program for that matter, Ghana. And Ghana's TB program has about $8 million annually. More or less, the highest you can get is $10 million because sometimes something comes. But that even reduces. Why does it reduce? You see, when a global fund is giving money to Ghana, they go into a counterpart financing arrangement. So, okay, global fund is giving Ghana about $300 million for the next 3 years. That's last year, this year, and next year. And Ghana is supposed to provide a counterpart financing arrangements of $45 million. Now, these $45 million could be Ghana government's contribution into procurement of logistics that go into the fight against these 3 diseases. Now, government is not able to fulfill its part. And the rule says if you are not able to fulfill your part, eventually they'll slash what you are supposed to contribute from your budget or from your allocation. So instead of you getting the 300 million, they might take off the 40 million out of it. You now are left with 260. Now, what it means is that part of your budget in a country must be cut off. So tuberculosis, for example, we don't have budget for next year's procurement. We have budget for last year, we had budget for this year. And because government is not able to fulfill its counterpart financing arrangement with the global fund, we are not able to reach why we want to reach. And so we need, what we are asking government to do is, look, we've signed to commit to TB. Mr. President, Mr. Minister of Finance, Mr. Minister of Health, let's find a way to prioritize TB. We know that there are many other things that kill many other people in this country, yes. But if we have 40 people dying every day in Ghana out of a particular disease, and see, we finance HIV more. And if you look at the HIV statistics, if you take 100% of the people that died out of HIV-related disease, they actually die, 40% of them die because of TB. And so TB is actually killing more than HIV and is killing more than malaria. And yet the resources that even go to TB are the least. If we are talking about $24 million for 3 years from the budget of Global Fund, and Ghana is not able to fulfill its counterpart financing arrangement, the budget of TB will come down to around 20 million. And 20 million for the space of 3 years, that's 36 months. When we should be talking about $90 million, we are talking about $20 million. The program is handicapped. So this year's team is saying, Mr. President, come on board. Let's find a way to support the program. Let's budget for the TB program. Let's support the program. If the program can get $30 million every year, the program will be comfortable to save their lives and find ways and means to ensure that we are able to eradicate TB. According to the global fund, the global target, we are supposed to be ending TB by 2030. That is a target. Now, because of the emergence of COVID, it has been shifted to 2035. In all of this, we are asking that we need government commitment, we need government investment so that we can deliver. And that is why we are choosing the team. Yes, we can end TB. But what we need is commitment from government and all other actors, the private sector, the media, the volunteers, the civil society organizations. Our commitment are needed. Judicious use of the resources that are made available so that we are able to monitor each other and save lives.
So, when are we going to be able to say goodbye to tuberculosis forever? Is that ever going to be a possibility?
Yes,
Is it possible to eradicate tuberculosis? You know, malaria has been eradicated in some countries.
yes.
A lot of diseases have been eradicated. Is there a point where we can say that malaria, tuberculosis has been eradicated?
Yes, it is possible. I mean, it's a disease that travels from one person to the other. If you have appropriate education and you have appropriate enough system of the diagnosis, and then you are able to mobilize communities, mobilize people, and get everybody who is actively living with the disease now, at the point where we are able to cure everybody out, and everybody is sensitive, everybody knows that, look, this is the way to go, we would have been, in fact, it's possible, because it is curable. If it was not curable, then we cannot eliminate it. So we can, if we invest in elimination. We can. But as it stands, we are not able to do it. And if we go in this abysmal investment posture, we will not be able to end TB. Because then we will not be able to reach all the people who needs to be reached. So you have more people having the disease and still transmitting it in the system, because we are not able to get them to cure them. In fact, treating those who already, or curing those who already have the active disease is a way of ending the disease. But the only way you can end the disease is when the last person who is actively living with the disease is cured of the disease. Now, if we are not curing, but then the people are dying, before you die, you would have infested people. Before anybody else dies, you would have infested people. In fact, you will infest more than 15 people a day if you have an active life. And so that is why Ghana has so much to do. Ghana has, if we are talking of 44,000 people, that's a lot of, imagine 44,000 people in one room that we need to cure all of them with TB. So we need to make sure we invest. If we can, yes, if we can invest, if we can commit, we can deliver it, we can cure it, and we can end it at one point in time. And that is why, you see, it's not one country business. Togo must be involved, Ghana must be involved, Cote d'Ivoire, every other continent in the world must be involved, because it's a global village now. Somebody is traveling from Togo to Ghana, and the next morning is in Benin, is moved from, and so the disease also can travel with people. And that means that it is not just Ghana, every other country must hold the bull by the horn, and then we all work towards that eradication. Otherwise, Ghana can be done well. But because people, of course, if you are in a country, just like COVID, you were coming to Ghana through the airport, you were tested. Yes, these are the approaches. These are the high, you need the president
but
to...
nobody tests you for tuberculosis when you're coming to Ghana.
Good. And so this is why we need to be sensitive to end the TB by bringing policy in. If we are serious, if the president gets interested, and we want to do anything we can do to make sure that we make Ghana a tuberculosis-free country, you introduce policies that matter. And that is the more reason why you need the artificial intelligence tools. So that when you get to the airport, in fact, in a matter of 5 minutes, you are already screened, and we can tell whether you are likely to be TB. And being likely to be TB doesn't mean that you should not be allowed to enter the country. Not at all. You are taken to the laboratory, and then they confirm with the first line diagnosis tool of Ghana. And then we are able to cure you, put you on treatment, because the treatment is the same everywhere. If you are detected in Ghana, you can be given a medication. When you travel back to your country, you can continue from there. And so it is possible, if only we have high level commitment from the Ministry of Health, from the president, and we are ready to do new policies, and just to make sure that, just as we even lock borders so we don't get COVID traveling into the country, we can create systems, invest in entry points, and at all points, school entries, everywhere. If you are able to put the diagnosis policy in place, that you invest in the policy implementation and get everybody involved, you can. It is possible. Because once the last person is cured off, it is off. We are done.
I've read some newspaper reports which suggest that there was an outbreak this year, but it's been contained. How true is that?
An outbreak of TB?
Yes.
TB has been a pandemic before, and we
had about 700 or so cases this year, but it's been contained.
No, TB, we have a whole national TB program. There is not anything like now an outbreak where, it has been an outbreak all these years. And if we are talking about in the normal stream of life, about 40 people are dying every day. Some die, you are not even aware who they are. The government can pinpoint that we know Mr. A, Madam B dying of it. It is only those who are in the hospital system where they are put on treatment and they couldn't make the cure successfully. That is also a number that is there. But to say there's an outbreak, no. It's TB is already an epidemic that is in the system, and we are doing everything we can to find ways and means to curtail on daily basis.
Is there some element of stigmatization with TB?
Yes. I mean, when people, the old story of the Samawa, like I've said, the name that is given to it, they always say you're
cough of ghosts.
The cough of ghosts.
Yeah.
That stigma, it makes people unable to get the necessary support they are supposed to get from their families. We have cases where you have a wife and a husband situation. TB is not sexually transmitted. If you don't take time, you might not have your wife or your husband wanting to be with you in one room because of TB. But this is the good news about it. People need to know that if you are already living with somebody with TB and you didn't even know, that's more deadly. Now, when you know the person is put on treatment, all you need to support the person with nutrition, help the person to remember to take his drugs. Within 14 days, the germs in the person, even if the person coughs out, cannot affect you. Now, the good news about it also is that there is also a medication. The National TB Program has what we call the treatment therapy, preventive treatment therapy. So if I am TB positive in the house and I'm living with my wife and children, they can give them medication. There is a kind of medication that is given them, so I still live with them and then they are safe. And so all these are part of the program progress that is being made in Ghana. And so stigma kills. In fact, if there's anything that is the reason why people die of many of the situations, it is because people have rejected you. People don't want to come close to you because they think they'll be affected. They think you're on the way to dying, and therefore they reject you. You don't get the food you're supposed to get. People will not communicate with you. They can't support you and get you to even get to the hospital and all of that. Maybe you don't have finance. People, when you are rejected, you are rejected. Stigma. If you don't take it is in the church. It is in the even in the hospitals. It's in the homes. So we need the opinion leaders. We need duty bearers. We need chiefs. We need imams. Our spiritual leaders. We need everybody to begin to speak about. Maybe should I call it the love of Christ or the love of God. So that even when people are in such dying situations, you become a good Samaritan to support the person get out of the situation, rather than leaving the people to their fate and not supporting them. The truth is, if you don't support somebody, what you sow, you can reap. Tomorrow, when it happens to you, the same way you were treating people, they will treat you. Whether it is HIV, is TB, is teenage pregnancy, or it's any other thing that people look at you and they think you have fallen below the standard or the norm, and they begin to speak against you and say bad things about you, spread your name as if you're already dead, and therefore you are, in fact, you psychologically die even before you physically die. And so we need to grow beyond as a country from attacking people who fall into one or two situations that are not to us acceptable. We should rather be accepting human beings. Human rights should begin at home. If somebody is a human being, your uncle, your father, your son, your wife, your husband, and there's a problem with the person, the best you can do is to support the person. Even if it's a terminal disease that you know this person will die, the best you can do is to support, not to run away and go and spread bad news about the person and eventually kill the person psychologically. So for TB, yes, Stigma has been one of the biggest challenges. But TB is not as dangerous as those blood pressure medications that people are taking.
Why?
TB is curable, and therefore, if once you are detected, you are given medication, you are cured. And if there's any
blood pressure,
I don't want to, I mean, if you are suffering from blood pressure and you are going to be taking medication for life, if you are on medication for 10 years, TB is 6-month treatment. You are cured. Which is better? You understand? Which is better?
Anyway, Doc, thank you very much for coming.
Thank you.
And we are most grateful.
Thank you.
And we do hope that you would continue to come and help us understand, tuberculosis and how we may all join in the fight against it. Thank you very, very much.
Great to hear that one from you. Thank you.
Now, for you out there, viewers, we'd just like to say thank you to you for being with us, for watching Talk Time, and generally for patronizing Pan-African TV. We are most grateful to you. Without you, we wouldn't have developed to this extent. So thank you very much, and keep watching Pan-African television because we give you the best in everything. On behalf of the producer of the show, George Biner, the director of the show, Edem Lumo, and Pan-African Television, it's goodbye from us, from our studios in Abelinkpe, Accra, and we will see you again very soon. Bye-bye.